Picture this for a moment. You are 72 years old. You open your mailbox on a quiet afternoon. There's a letter from Medicare. You sit down at your kitchen table, slide your finger under the seal, and begin to read. Your monthly Medicare premium just went up. Not by $10, not by $50, by more than $600 a month, every single month, for the rest of your life. You read it twice, 3 times. Your hands start to tremble. You look at your fixed income. You look at your grocery list on the counter. You look at the heating bill sitting next to the toaster, and you realize you cannot afford this. How did this happen? You thought you did everything right. You waited to enroll because your neighbor told you to. You kept your old insurance because your son said it was cheaper. You delayed because you felt healthy. But what nobody told you, my friend, is that one small decision at age 65 can quietly destroy your retirement budget for the next 20 years. Hello, my friend. I am Masha, a senior policy analyst here at TaxWise Seniors. For years, I have helped retirees understand the complicated rules that hide inside Medicare, rules that nobody explains in plain English, rules that turn small mistakes into lifetime penalties. Today, I am going to walk you through the single most expensive Medicare mistake a 65-year-old can make. I will show you the exact rule. I will show you the exact dollar amount. And I will show you the 3 steps that protect you from ever falling into this trap. Please, stay with me until the very end, because there is one hidden mistake, a quiet, sneaky mistake, that catches even the most careful retirees. I will reveal it near the end of this video. Don't skip ahead. You'll want to hear this carefully. Let me tell you about Harold. Harold is 65 years old. He lives in North Carolina. He worked as a respected accountant for 42 years. A careful man, a numbers man, the kind of man who reads the fine print before he signs anything. When Harold turned 65, he was still working part-time at a small CPA firm. The firm had only 12 employees. Harold's boss told him, "Don't worry about Medicare yet, Harold, you're covered here." Harold believed him. He trusted his employer. He kept working part-time for 7 more years. Then Harold finally retired at age 72. He went to enroll in Medicare. He filled out the forms. He waited for his confirmation letter. When the letter arrived, Harold sat down. His Medicare Part B premium was not the standard $202. It was $344.93 a month. For life. That extra $142 every month was a lifetime late enrollment penalty, plus a Part D drug penalty on top, plus an income surcharge from a one-time home sale 2 years earlier. Together, Harold was paying over $600 a month more than his neighbor for the exact same Medicare coverage. Harold called me in tears. He said, "Masha, I'm an accountant. I should have known. Why didn't anyone tell me?" That's why I'm telling you today, so this never happens to you. Let me walk you through what happened to Harold piece by piece, so you can protect yourself. Number 1. The 7-month window that decides everything. When you turn 65, you have a 7-month window called the Initial Enrollment Period. This is according to Social Security Administration guidance. That window includes the 3 months before your 65th birthday month, your birthday month itself, and the 3 months after. 7 months. That's it. Now, here is something most seniors do not know. If you are already collecting Social Security at 65, Medicare enrollment is automatic. The government signs you up for Parts A and B without you doing anything. But if you delayed Social Security, and many smart seniors do, to get a bigger check later, then nothing happens automatically. You must manually enroll yourself through the Social Security Administration. If you don't, the clock keeps ticking, and the penalties begin. Many seniors believe they can enroll anytime they want. That is false. Outside of your 7-month window, you can only enroll during the general enrollment period from January 1st through March 31 each year, and the moment you miss your initial window, a lifetime penalty begins to attach to your name. Number 2. The lifetime Part B penalty. This is the rule that hurt Harold. According to Medicare.gov, you pay an extra 10% on your Part B premium for every full 12-month period you could have enrolled but didn't, and this penalty is permanent. You pay it for as long as you have Medicare, which, for most seniors, means for the rest of your life. Let me give you the real numbers using official 2026 figures. The standard Medicare Part B premium in 2026 is $202.90. If you delay just 1 year, you pay an extra $20.29 every month. Forever. Delay 3 years? $60.87 extra. Every month. Forever. Delay 7 years like Harold? $142.03 extra. Every month. Forever. Delay 10 years? The penalty is 100%. Your premium effectively doubles. Forever. Over a 20-year retirement, a 7-year delay cost you about $34,000 in penalties alone. That is a car. That is a year of groceries. That is your grandchild's college fund. And here is the trap. Many seniors believe their retiree health insurance, their COBRA coverage, their VA benefits, or their Affordable Care Act Marketplace plan allows them to delay Part B without penalty. It does not. The only coverage that legally protects you from the penalty is active employer coverage from current employment, yours or your spouse's, at a company with 20 or more employees. Harold's firm had 12 employees. 12, not 20. So Medicare was supposed to be his primary coverage from age 65. His employer plan was secondary, he just didn't know. The protection here is a form called CMS L564. Your employer must complete this form to verify your employment-based coverage. You submit it together with Form CMS 40B during your special enrollment period. Without that paperwork, the government has no proof to waive your penalty. Number 3. The drug coverage penalty nobody sees coming. Now we stack the second penalty on top. According to Medicare.gov, the Part D late enrollment penalty is calculated by multiplying 1% times the national base beneficiary premium, which is $38.99 in 2026, times the number of full months you went without creditable drug coverage. This penalty is triggered the moment you go 63 or more days in a row without proper drug coverage after your initial window ends. Healthy seniors fall into this trap all the time. They think, I don't take any prescriptions. Why should I pay for Part D? So they skip it, and every month the penalty grows quietly in the background. By the time they finally need medication at age 72 or 75, the penalty is locked in for life. Harold delayed Part D for 7 years. 84 months. His permanent penalty became $32.75 every month. For life. Just for the drug coverage piece. Now combine that with his Part B penalty of $142. Harold was paying nearly $175 in penalties alone, every single month, forever. That's over $2,000 a year, gone, with nothing in return. The protection here is something called a Notice of Creditable Coverage. By federal law, every employer or insurer that provides drug coverage must mail you this notice every September. Please, my friend, keep these notices forever. Put them in a folder. Put them in a fireproof box. Because if you ever need to prove you had valid drug coverage, this notice is your only shield. Number 4. The income surcharge called IRMAA. This is the silent killer, the one that ambushes successful retirees. IRMAA stands for Income-Related Monthly Adjustment Amount. It is an extra surcharge on your Medicare premium based on your income from 2 years earlier. Listen carefully. 2 years earlier. So your 2026 Medicare premium is based on your 2024 tax return. The tax return you may have already forgotten about. Here are the verified 2026 brackets for a single filer. If your income was $109,000 or less, you pay the standard premium, $202.90. But if you earned even $1 over that, your premium jumps to $284.10. That's $81 more every month for an entire year. Higher income brackets pay much more. The highest earners pay $689.90 per person per month. That is nearly $5,850 extra per year per person. Now, here is the trap that catches good people. IRMAA looks at your income from 2 years ago. So if you sold your home in the year you turned 63, or did a large Roth conversion, or took a lump sum pension payout, or received an inheritance, that one-time event triggers IRMAA right when you retire and your income drops. You go from earning a salary to living on Social Security. But Medicare punishes you for income you no longer have. The protection here is a powerful form called SSA-44. This form lets you request a reduction after what the government calls a life-changing event: marriage, divorce, death of a spouse, work stoppage, reduction in work hours, loss of pension, loss of income-producing property, or an employer settlement. If any of these apply to you, file Form SSA-44 with Social Security. Not Medicare, Social Security. They are the agency that handles IRMAA appeals. Number 5. The benefit half of eligible seniors never claim. This is the one that breaks my heart the most. There are 4 programs called Medicare Savings Programs. They help low and middle-income seniors pay their Medicare premiums, deductibles, and copays. The Qualified Medicare Beneficiary Program, called QMB, pays your Part A and Part B premiums, your deductibles, your copays, and your coinsurance. The Specified Low-Income Medicare Beneficiary Program, called SLMB, pays your Part B premium. The Qualifying Individual Program, called QI, also pays your Part B premium. And here is the bonus. If you qualify for any of these 3 programs, you are automatically enrolled in something called Extra Help, which lowers your Part D drug costs. Income and resource limits vary by state. Some states have no asset test at all. Many middle-income seniors qualify and never realize it. According to research from the Kaiser Family Foundation, roughly half of all eligible seniors never apply. They believe these programs are welfare. They feel embarrassed. They think they earn too much. But these are programs you and your spouse paid into during your entire working life through your payroll taxes. This is your money coming back to you. You apply through your state Medicaid office, not Social Security, not Medicare, your state Medicaid office. And here is a federal protection most people don't know about. Once you qualify for QMB, federal law prohibits doctors and hospitals from billing you for Medicare cost sharing. This is called balance billing protection. If a provider tries to bill you anyway, they are breaking federal law. A QMB-eligible senior who never applies loses over $2,400 a year in benefits. Combined with the unclaimed Extra Help subsidy, that loss can easily exceed $600 a month. Now, my friend, let me give you the 3 exact steps you must take. Please write these down or pause this video and listen again. Step 1. Mark your calendar 3 months before your 65th birthday. That is the start of your initial enrollment period. Even if you plan to keep working, even if you have other coverage, even if you feel perfectly healthy, call Social Security and ask in writing whether you need to enroll. Get the answer in writing, always in writing. Step 2. If you are still working at 65, count the employees at your company. 20 or more, you may delay safely. 19 or fewer, Medicare must be your primary coverage starting at 65. And if your employer plan is your protection, get Form CMS L564 completed and saved in your records before you leave that job. Step 3. Save every notice of creditable coverage you receive every September. Save every Medicare letter. Save every tax return for at least 7 years. If you ever face an IRMAA surcharge or a late enrollment penalty, your paperwork is the only thing that can save you. Now, here is the hidden mistake I promised you at the beginning. The mistake that catches even the most careful seniors. It is COBRA. When seniors retire or lose their job, many sign up for COBRA to extend their health insurance. They believe COBRA gives them the same protection as active employer coverage. It does not. According to Medicare.gov directly, if you have COBRA and you're eligible for Medicare but not enrolled, COBRA may only pay for a small portion of the healthcare services you get. COBRA does not extend your special enrollment period for Medicare Part B. The clock keeps ticking, the penalty keeps growing, and many seniors only discover this after 18 months of COBRA, when they finally try to enroll in Medicare and discover they owe a penalty for life. If you are on COBRA right now and you are 65 or older, please pause this video. Call Social Security tomorrow morning. Enroll in Part B immediately. Do not wait one more day. My friend, please listen carefully now. YouTube does not always show you my videos. The notifications you rely on don't always arrive. Medicare rules change every single year. New brackets, new penalties, new deadlines, new traps. You cannot afford to miss them. That is why I want you to click the link in the description below and join the Global Senior Alerts official WhatsApp channel. It is completely free. The moment you join, you will receive your free copy of the Senior Benefits Protection Guide, a simple, plain English booklet that walks you through the rules that protect your Social Security, your pension, your bank accounts, your insurance, and your travel rights. You will also receive real-time alerts. The moment a Medicare rule changes, the moment an IRMAA bracket shifts, the moment a new scam targets retirees, you will know first. Do not wait until a $600 bill arrives in your mailbox. Do not wait until your savings drain away one penalty at a time. Do not wait until it is too late to fix. Click the link now. Join us. Protect yourself, protect your spouse, protect everything you spent a lifetime building. This is Masha from TaxWise Seniors. Thank you for trusting me with your time today. Stay informed, stay protected, and I will see you in the next video.